Again, I'm Cliff Dupre. I'm with the Salute America team and the team here at UT Health San Antonio. Welcome to the next webinar in our series, Let's Improve Health in South Texas and Beyond. Today's webinar is What You Should Know About Your Amazing Liver. Our moderator is Dr. Amelie G. Ramirez. Dr. Ramirez is director of the Salute America National Health Communication Program. She also directs the Institute for Health Promotion Research at UT Health San Antonio. She spent over 30 years directing communication interventions and research to reduce chronic disease and cancer health issues affecting Latinos. She's also Associate Director of Cancer Outreach and Engagement at the NCI designated Mays Cancer Center at UT Health San Antonio. Dr. Ramirez?
Thank you so much, Cliff, for the introductions. And we're so excited to have this amazing panel with us here today. So thank you all for making time. Thank you to our participants who are signing in and who are currently with us for this webinar. We really appreciate having you here. You know, we wanted to really share this important issue about liver health. We are told that our liver is a key to our overall health. It performs hundreds of essential functions in our bodies that many of us are totally unaware of. And so yet the liver health has become a growing concern throughout the US. We here at Mays were some of the first to identify that we had higher liver cancer rates in our South Texas community compared to the rest of Texas and the nation. And so now, based with research, we know that some people are impacted by liver disease at higher rates than others. Why does this happen? And how can we address this concern? Today, we hope that you will learn how to improve our liver function and see how modern lifestyle and environment are currently impacting our liver health. We are fortunate to have a great panel that can help us explore the state of liver health in South Texas and beyond, as well as identifying solutions, preventative treatment advances, and other available resources. I'm going to introduce our first three panelists, and then our fourth panelist I will introduce last, as they are our webinar sponsors. So today we have with us Dr. Eugenia Tsai. She's Assistant Professor of Medicine and Associate Program Director for Transplant Hepatology Fellowship Program at UT Health San Antonio, and she's also the Director of the Hepatobiliary Cancer and Resident and Fellow Education Program at the Texas Liver Institute. Dr. Fabian Vicente Rodas Ochoa is Assistant Clinical Professor of Medicine at UT Health San Antonio and Director of the Transplant Services at Texas Liver Institute. And Jennifer Butler is the Executive Director of the Texas Liver Foundation. In just a minute, you'll hear from each one of them. However, I'd like to introduce our first speaker, who represents our webinar sponsor, Genentech, a biotechnology company and a member of the Roche Group. We are pleased to have Dr. Dawn Brown with us. With Genentech, Dr. Brown is the Principal Medical Science Liaison. She focuses on breast, gastrointestinal, and gynecological cancers across Texas. Welcome, Dr. Brown. We're so delighted to have you here today. As we start our session, I wanted you to share just a few words with us as, why is Genentech interested in liver health and liver cancer?
Thank you, Dr. Ramirez, and thank you to the organizers, Salute America and UT Health San Antonio, for welcoming us today. It is especially meaningful for us to be able to come here today and discuss liver health during Liver Cancer Awareness Month and Hispanic Heritage Month. So my background at Genentech, as Dr. Ramirez has shared, is focused on gastrointestinal cancers across Texas. Our company is dedicated to pursuing groundbreaking science to discover and develop medicines for people with serious and life-threatening diseases. And historically, we've been deeply engaged in the treatment of hepatocellular carcinoma, or HCC, which is the most common form of liver cancer. So we were blessed to be part of a landmark advance in first-line systemic therapy for unresectable HCC, where our combination regimen was the first cancer immunotherapy combination to demonstrate statistically significant and clinically meaningful improvement in overall survival compared to the long-standing standard of care. And this achievement resulted in an unprecedented 42% reduction in the risk of death. And while we were also that part of defining really what that current standard of care is today, as a company, we do not just want to be part of the current state. We want to make sure that we do now what patients need next. And this core principle really drives our expansion to embrace the entire continuum of liver disease in what we call our One Liver approach. So as part of this approach, MASH, which has become part of our next frontier, which and is a serious progressive form of fatty liver disease, is rapidly becoming one of the fastest growing causes of HCC, and it is closely associated with the global rise in conditions like obesity and type 2 diabetes. And this focus is acutely necessary in Texas because, as many of you already know, and Dr. Ramirez has shared, Texas has some of the highest rates of HCC incidence and mortalities in the United States, and is driven by very metabolic risk factors. And critically, Hispanic adults, particularly those in South Texas, experience a disproportionate burden of both MASH and HCC. So at Genentech, our strategic commitment is to prioritize rigorous research aimed at resolving MASH and fibrosis. And by treating MASH directly, we aim to minimize the chronic liver cell injury that causes an increase in risk in cancer. And by doing this, we feel that it will have a nice trickle-down effect to help us mitigate the increase in health risks that we now see in South Texas. And I'll stop there.
No, great information, and thank you so much. Dawn, this is so valuable, and we need to really make headway in this. And this is an area that I've been interested for almost 20 years ago. I lost my own father to liver cancer, and he was diagnosed very late, and very little was available for him. So it's just so wonderful to see the new advances that we've made on this area. So thank you very much for your remarks, and we'll come back with you for a few more questions. Now I'd like to go to Dr. Tsai. Can you describe the burden of liver disease and liver cancer, particularly here in South Texas, and its majority Latino population, as we've just heard from Dr. Brown, and share with us some information that you are seeing and what's really contributing to this issue.
Yeah, absolutely. First, thank you everyone for joining us today. And thank you for the organizers for inviting me. I apologize. I'm still recovering from a laryngitis, so a very inopportune time. So hopefully my scratchy voice isn't too irritating for the audience. I think for today's webinar, we're going to hear a lot of reverberating themes, which is mainly the fatty liver, the MASH, and then the risk of HCC. So when we talk about liver health, what we're really talking about is that the liver health is a mirror for the community's overall metabolic health, because the liver basically silently reflects what's happening with our weight, our diet, our sedentary lifestyle or exercise, and our environment. And the liver hangs on and does well until all of a sudden when it can fail. Across the United States, liver disease and liver cancer, like Dr. Brown mentioned, HCC, hepatocellular carcinoma, are now among the leading causes of preventable death. And in South Texas, this is one of the hardest hit regions. So among the Latino population in particular, we're seeing a 2 to 3-fold risk of HCC, and that's not random. It's actually a mix of metabolic, genetic, and social determinants. And oftentimes patients actually ask me, what's driving this? What makes it different now compared to before? And so really the number one culprit nowadays, whereas a decade ago, viral hepatitis was the leading etiology for liver disease, nowadays what we're seeing a lot more is fatty liver. What we used to call non-alcoholic fatty liver disease, or NASH, NAFLD, is now more accurately described as MASLD, or MASH, so metabolic associated steatotic liver disease. And what that addresses is the metabolic dysfunction, the metabolic risk factors such as obesity and diabetes. And the rates of those two are actually amongst the highest in the country in South Texas. And so especially among Mexican American adults and even children, we're seeing this at a younger and younger population, is that there is this metabolic fuel behind most of the liver injury that we're seeing. And when you add that to alcohol use, which still remains a major cofactor in liver disease, what we see as a result of a synergistic liver damage, the combined fatty liver along with alcohol damage. But beyond biology, the environment and the genetics do amplify this risk, is what we're seeing here in South Texas. And so in South Texas, there are oftentimes areas with limited access to fresh foods, high density of processed fast foods, and the health literacy is also something that we take into consideration. So, in terms of limited access and this silent liver disease that is progressing, this is all contributing to the worsening of fatty liver and oftentimes presenting or being diagnosed, unfortunately, at later stages. And like Dr. Ramirez, you mentioned, sometimes, unfortunately, when we find it at later stages, we have fewer treatment options, unfortunately. And I just want to mention that the old story used to be viral hepatitis. And obviously, we're not forgetting about that. We're still screening our patients for viral hepatitis B, viral hepatitis C. But again, fatty liver is very different in this population. And there are genetic risk factors in the South Texas population where we're seeing genetic changes. And what we know from scientific literature is that Latinos carry a specific gene variant, which is the PNPLA3 gene. And this makes the patients more likely to store fat in the liver, more easily develop liver fibrosis and scar tissue, even if their BMIs are not so high, and even if their diabetes are not poorly controlled. So overall, what we're seeing in South Texas is a rise in MASLD, MASH, and it's now surpassing viral hepatitis as the leading cause of liver disease, leading cause of liver cancer, and even one of the leading causes for the need for liver transplantation. We're not just seeing it in older patients, we're seeing it in young patients as well. Again, the combination of genetic risk factors, environmental risk factors, we're seeing patients with fatty liver needing a liver transplant even in their early 30s and 40s nowadays. So after adjusting for these metabolic risk factors, we find that the Latino population still shows a higher risk for HCC. And this again just suggests that there are multiple drivers, the genetics, the delayed diagnosis, the access to care. And all of these have implications for transplant. And so overall, the concept would be prevention, early identification is key. And I just wanted to end that in terms of transplant centers, we actually have seen this pivot firsthand, where again, fatty liver is overtaking a lot of the other etiologies as a need for liver transplant. And the main concept is how would we turn this around? What we're seeing, this trend that we're finding, what the ideal scenario would be is that we work on screening and identifying the liver diseases at an early stage, which is doable.
No, thank you so much, Dr. Tsai. That is such an important information, and that early detection is really a theme that we can get across to our audience today. Dr. Rodas Ochoa, I know you can share some important ways to keep our liver healthy. How are you treating liver health in your clinic, and what are some of the emerging treatments?
Yeah, well, touching on what Dr. Tsai just mentioned, we understand that liver disease is multifactorial. We now understand that more and more patients have multiple metabolic risk. There is an increased prevalence of obesity, dyslipidemia, metabolic risk that add complexity to the management of these patients. And we understand that liver disease is very common. In fact, it represents and inflicts 1 out of 3 people around the world, right? And globally, liver disease and liver cancer are among the leading causes of death, as we mentioned. Particularly here in Texas, where we've seen a markedly increase in the rates of liver cancer, which is unclear. One hypothesis is perhaps these high metabolic risk factors. So that makes early detection and prevention absolutely critical. Good news is that many liver conditions are fully preventable, and that easy interventions, such as lifestyle changes, maintaining a healthy weight, can be effective. For instance, following a Mediterranean diet, a diet that is rich on fruits, vegetables, olive oils, omega-3 fatty acids, can help maintain weight loss for longer and helps reducing cardiovascular risk. This is the diet that we recommend strongly, not just because of weight loss maintenance, but because of the decreased cardiovascular risk by 30%. The CDC also recommends approximately 150 minutes of weekly exercise, moderate exercise that will include a very brisk walk, biking at 10 to 12 miles per hour, vacuum, washing the windows, and maybe mowing the lawn as well. And even these days, playing pickleball, as it's becoming more and more prevalent these days. Now, that's in terms of prevention. As Eugene mentioned, hepatitis A and B vaccinations are the most effective tools for cancer prevention. Similarly, screening for hepatitis C and the advent of the newer therapies that have changed the landscape of liver disease dramatically these days. In terms of therapy, we are living an exciting era of drug development and discovery. I'm proud to say that many of the compounds currently available were developed right here at the Texas Liver Institute. For instance, medications such as resmetirom, which is a thyroid hormone receptor beta agonist, as well as semaglutide. Both are FDA-approved therapies for the management of patients at risk, F2 and F3 fibrosis. So those are the patients we have to tackle to prevent the progression of these patients with muscle disease, the so-called fatty liver. That's beyond the activity that we see in obesity, as well as patients with diabetes. Now, the GLP-1s are approved for the management of these, and many providers may not be aware of that. Additionally, I was personally involved in drug development for seladelpar and elafibranor. These are therapies, PPAR agonists approved for the management of progressive primary biliary cholangitis or PBC. Those are cholestatic disorders that are common as well we've seen some cluster of patients in South Texas, which is unclear. But those are now available for the management of these conditions. Additionally, as we mentioned, liver transplantation continue to be the definitive therapy for patients with more advanced liver disease. And equally at this same level, we are continuing to evolve and improve these preservation techniques for donors, as well as surgical approaches, and post-operative care has drastically improved. Additionally, these interventional radiology techniques, such as ablation, embolization, that give us some bridges for transplantations in those patients who are not surgical candidates. So there's a lot of opportunity for these patients. I think one of my roles for tackling these issues, I'll say, spans in education, prevention, collaboration with the teams and colleagues, as well as our interaction with the community and the industry to give more opportunities to our patients that previously didn't have options. And I can say that additionally, I can say one of the main barriers is awareness in liver disease, not only among patients, but also among clinicians. And therefore, the main goal these days is to tackle this by educating providers. And thankfully, we've partnered with UT Health San Antonio to train the next generation of liver specialists to have access to this liver care, right? To have more and more clinicians ensuring they can recognize and manage liver care earlier. And importantly, I will say that our goal is not only to treat, but also to prevent. And that's difficult because liver disease is silent. Despite being silent, we need to be more aggressive in terms of detection, innovation, awareness, and care.
Thank you very much, Dr. Flores Ochoa. That's so important. And I kind of equate, and I'm aging myself here, but the silent killer used to be high blood pressure. But now this is truly a silent killer. You really don't feel some of those signs or symptoms until it really has grown and there's more severe illness. So the prevention and access to that information is extremely important. So thank you for your remarks. Now I'd like to, we've just heard from our three speakers, and they really have set the stage of what we need to know about liver health. Now I'd like to transition to Jennifer Butler. She's with the Texas Liver Foundation. Jennifer, can you describe the tremendous need for advocacy and caregiving support for our patients with liver disease?
Absolutely. Thank you, Dr. Ramirez. Hi, everyone. Again, my name is Jen Butler. I am so honored to be here today. I'm the executive director of Texas Liver Foundation, and I'm also an anonymous living liver donor. Having been on both sides as a donor/patient and as an advocate, I've seen and felt just how important support is for anyone fighting liver disease. And today I'm going to share a little bit about why advocacy and caregiver support are so critical and how organizations like ours help fill the gaps that traditional medical care alone can't always cover. And I want to start by acknowledging that there are amazing care teams in South Texas. In fact, I chose to donate my liver at University Hospital in San Antonio just this past July. July 10th, coming up on my 90 days. But even with the greatest doctors and hospitals, navigating liver disease is overwhelming. Patients and caregivers face not just the physical challenges of the illness, but also emotional and logistical challenges too, like hospital stays, complicated and sometimes hard to understand treatment plans, stigma, coordinating care, managing medications, sometimes working through depression and isolation. And caregivers often carry a huge weight, not just from supporting their loved ones through their illness, but also helping keep medical appointments and care organized and just trying to manage life in general on top of everything. And so when I went through the process of becoming a liver donor, I learned really quickly just how complex and emotionally challenging all of it can be, even though I had an absolutely brilliant care team. And don't get me to start talking about University Hospital. They were top notch. It was a fantastic experience. But pre-surgery preparation, navigating my hospital stay, finding local lodging, making sure my caregiver had what they needed, recovery, coordinating post-release care was a lot to juggle. And what really made a difference for me were the people and resources I could lean on, like other liver donors, peer groups, educational materials, and having structured peer support and guidance really can make parts of these journeys feel less isolating, less confusing, and even less stressful. So my own experience 100% reinforced for me why advocacy organizations are so important. They enhance care, and in some cases, they help save lives because they're able to get out and meet people in the community where they are, bringing support, education, and resources to those who may not have a provider or who maybe don't realize that they really need to get in and have a conversation with their doctor. These programs help patients and families feel less alone and feel more empowered to make decisions for their health and well-being. People need guidance, they need resources, and they need a community that's ready and that's there and ready to lift them up. And sometimes they just need somebody who's walked in their shoes, can help them make sense of what's happening, or at minimum, help them feel like they're not alone. So at Texas Liver Foundation, we focus on helping fill those gaps, not just through support, but also through education. One of the things we're working on the advocacy side in collaboration with some amazing partners is a statewide effort to promote early screening for rare pediatric liver diseases, something that can be truly life-saving for kiddos born with these rare diseases who might initially slip through the cracks. We also work in the community to provide education on liver health and help people get the tools they need to take control of their health or work with their doctor to get on the right track. Then on the support side, we provide programs that help patients and caregivers in very practical ways. We run virtual support groups for transplant patients, for caregivers, and for living donors. Spaces where people can connect with others who really understand what they're going through. We connect people to disease-specific organizations and nonprofits when that's what they really need. And we also send care packages to hospitalized pediatric and adult liver patients to help ease a little bit of the stress and just help them feel more seen. And when we provide additional support outside of the walls of the clinic, we help empower our communities to advocate for their health, and we help patients and families feel less alone and better equipped to make decisions that are the best decisions for themselves. So what we've learned is that effective advocacy and support programs have a few things in common. The first is that they make resources easy to access and easy to understand. The second is that peer-to-peer connections, either through support groups or mentorship programs, can create safe places for people to share experiences and offer guidance, personal guidance. And third, combining education with practical support, either like care packages or regular check-ins, those can help reduce stress, and that reduction in stress can oftentimes improve outcomes. So when programs focus on these areas, they truly complement clinical care and help patients and families thrive. So to close, I'm going to reiterate that in my opinion, patient advocacy and support and caregiver advocacy and support are absolutely essential to liver health. Every patient, every caregiver, every donor benefits from having resources, guidance, and a community behind them. And we are proud to provide just some of that support in Texas. So I encourage everyone who's watching today to consider how you might connect with or volunteer for support efforts like these in your own community, because as everyone has heard, and I truly believe we are stronger together. Thank you.
No, gosh, that's great, Jennifer. Thank you for your enthusiasm and thank you for all that you do. And you've just been a wonderful role model for all of us and how we can contribute to helping others. And as we heard from our speakers, this disease is being diagnosed earlier and earlier in many of our populations, and we need to do more. And Dr. Rodas Ochoa, you mentioned that we need to even do more to educate our providers. We have a question here from one of our audience members, Melinda. She asked, how do you get your doctors to test your liver? She says, my doctor mentioned that they are doing blood work to see if there's proof to need to do more. He said that everything has to have its own proper codes before they can move to the next step.
Well, that's a very important question, not just only for, again, a patient. I know the patient in this setting is asking, what's the next step? And that's key because the awareness is not only on patients, but also primary care setting. That's where we need to concentrate our effort. And let me give you an example. Patients with type 2 diabetes and obesity can have normal liver enzymes, and the prevalence of fatty liver, right, MASLD, it's approximately 75%. So 75% chances that a patient with diabetes will have fatty liver or steatotic liver disease. And so we need to start screening because, as we mentioned, these patients are frequently asymptomatic, and by the time they come to us, it's already too late. They may have advanced liver disease or even cirrhosis and even cancer, liver cancer. So the goal is to screen. There are ways to screen. The best test to screen is by doing something called FIB-4 that includes your labs, maybe a combination of the transaminases, your age, your platelet count. If that's abnormal, then the next step is to obtain elastography. So elastography is a test that measures the stiffness of your liver. So usually when you get liver disease, it progresses to scar tissue fibrosis, and the stiffness of the liver is measured by this technique, this non-invasive test. It's like an ultrasound. It's a special probe that we apply to your liver. You get some vibrations, some waves, and that can give us an estimate of the stiffness of your liver, the scarring of your liver. That's usually key. That's the next step. I recommend strongly that you, as a patient, advocate for yourself. Go talk to your primary care provider and request an elastography. What's the next step? You maybe go next time, talk to your doctor. See, I went into a webinar and a hepatologist recommended use of a FibroScan or an elastography, something to assess my liver. Okay, that's the next step because, again, this condition may not be symptomatic and we need to start detecting earlier, particularly those patients with metabolic syndromes. The higher the metabolic risk, the higher the risk of advanced fibrosis. And that's, again, diabetes, high BMIs, low HDL, high triglycerides, and hypertension.
Great. Well, thank you so much, Dr. Rocha Ochoa. Dr. Desai, you mentioned in your remarks about there might be a genetic marker here. If a person has liver disease or liver cancer, is the person's family member at higher risk?
That's a great question. And yes, there are genetic predispositions. And what I typically tell patients is that even though we may not always know the genetics behind things, what we do know is that diabetes runs in families, high blood pressure runs in families, obesity and the way we eat, that is very much coming from the environment and from family. And so with metabolic diseases and the risk for fatty liver, if their family members have fatty liver and diabetes and obesity, then yes, the patients will be at higher risk for the development of fatty liver as well. And that in turn confers a higher risk for the development of liver cancer. In terms of the genetic marker that I mentioned, which is the PNPLA3 gene, that mutation is higher in our South Texas population. So to a certain degree, that will run in families as well. So again, the genetics and environments combined confer a higher risk. And I think this just brings it back to what Dr. Rodas was talking about, which is early identification, advocacy for the patient themselves to say, I have a family member with liver cancer. My family member has fatty liver. Can I get evaluated for it? That's very important. And just overall thinking about what's good for the heart will also be good for the liver, right? We're focusing so much on the liver. I'm a liver doctor. But what I tell my patients, because they always get worried about their liver, is that it's the same risk factors that affect having a heart attack, having a stroke. We are working towards decreasing weight, improving blood sugars, improving the lipid panel, not just for the liver itself, but also for long-term overall heart health, brain health, overall just health.
Overall health. Very good. Very good. Thank you. Dr. Brown, we have a question from the audience, from Claudia. She's wondering if we do change our lifestyle, and we have been diagnosed with kind of some type of liver disease, will it change if we change our lifestyle? Is there a reversal opportunity here?
I don't, so every time that you change your lifestyle, you reduce the risk and your ability to increase those type 2 diabetes or the disease we're talking about today. So a lifestyle changes always reduce your risk. As we mentioned today in the panels this year, there are genetic factors that you need to consider. And then there's also social determinants of health that we often have to consider that are impacting some of the patients as well. So the goal should be, as Dr. Sai had mentioned, changing your lifestyle and being a whole person, change your whole health as a person and an individual in order to reduce your risk for any type of disease. When it comes to reversal, I don't necessarily want to speak to that. I can't say that I've seen the data to show that it reverses, but it reduces your risk, and that should be the focus of a lot of the work that we do.
Can I jump in?
Yes, please.
Yes. Yes. Well, the most effective intervention for reversal in liver disease is, particularly in patients with steatotic liver disease, is weight loss. We all understand this is very difficult to achieve. It's probably the most challenging thing to accomplish, because we live surrounded by this environment where we are tackled with this information. We have food available 24/7, and that wasn't the case. Historically, we didn't have all that's available these days. But weight loss, 10% weight loss, is associated with improvement and reversal on fibrosis. So just 3%, the fatty liver will improve. 5 to 7% inflammation in the liver will improve, and 10% the scarring, right? We were talking about scar tissue. That will improve. Remember that we are tackling patients with F2 and F3 fibrosis. Those are the patients that are going to progress to bad outcomes. So you want to really get out of that state to F1 or F0 by attaining lifestyle choices, healthy choices, weight loss. We all know it's difficult, but yes, it can be done. And that's why you need to see your primary care provider, see your nutritionist, see your hepatologist. This is a multifactorial condition, okay? It's not easy to treat. That's why it's a multidisciplinary approach to tackle all these increased risk factors.
And there was another panelist, Jorge, who mentioned, he said, how do you change lifestyle? We know, especially in our culture, in our Latino community, that's some of the hardest things. So Jennifer, what kind of educational knowledge are you sharing with the community on lifestyle factors?
We have a really heavy focus on fatty liver disease or MASLD. When we attend as many health fairs as we can get invited to and can logistically make it to, and we provide basic information. We're not doctors. We have doctors on our in our board, but it's important for people to be in touch with their doctors. But what we can provide is some just general nutritional guidance, general exercise guidance, and general knowledge about liver disease, so that people in the community have the information to know that they may be at risk, or they should be in touch with their doctor just to do a check-in.
Great. Thank you. Appreciate it. Yeah. No, and providing that information in multiple languages and so forth, so that we make sure that we reach all our audiences is extremely important. And also as was mentioned earlier by Dr. Brown, the literacy level is critical for us to think about as well. So, Dr. Tsai, in terms of the other issues contributing to liver cancer, is there a proportion of different risks, like if alcohol consumption versus fatty foods or lack of exercise? Is there one more important than the other?
So the biggest risk for development of liver cancer would be the presence of cirrhosis. And we've talked a lot about early identification of liver disease and reversibility of fatty liver if we work on weight loss. But one thing that I think we're still under recognizing is early stages of scar tissue to the point of irreversibility. So again, kind of identifying patients who are at risk for fatty liver, working on reversing it with healthy lifestyle, which, like you mentioned, can be tough. But what I want to emphasize is little baby steps, right? I tell my patients, I don't expect you to leave this office visit and go out and run a mile. That's not what I'm looking for. I'm looking for slow, small, sustainable changes that make this worthwhile and long lasting. This is a marathon, it's not a sprint. And so the idea would be to control the liver disease, reverse it to a point where we do not develop cirrhosis, and then that will decrease the risk of the development of liver cancer. I will say we are now starting to see that in patients with fatty liver with MASLD, they can actually develop liver cancer without the presence of cirrhosis. It's not common, but it's a very small population, but that is something that we're seeing. So again, focusing on targeting metabolic risk factors, controlling those, reversing diabetes and keeping blood sugar well controlled, working on weight, those are going to be still the most important factors.
Great, thank you. Dr. Rocha, recently, our community drinks a lot of sweet and sugary beverages. And so sometimes they, might think, well, I'll just change to a diet drink. But why are even diet drinks contributing to liver cancer? What is in that product?
Well, in terms of your question is probably more directed to added sugars, right? I strongly recommend, I think that's an everyday in my practice about the limitation of added sugars and sugar sweetened beverages overall. That includes soda, unsweetened soda, juices, sports drinks, energy drinks, all of them, because they bring empty calories. Okay, they just lead to overconsumption. And that's added to the ultra-processed foods or the UPFs. And they contain these highly refined sugars. They absorb easily. You don't burn any calories. Usually when you even eat sugar, you burn calories. But when you take these refined sugars, your body doesn't, it's very easy to absorb that on top of industrial fats and flavor enhancers that what they do is they fool your satiety signals that perpetuate your overeating, right, and perpetuating this epidemic of obesity. Those these sodas with no calories, they will not increase your sugar, right, at the blood level. But what they do is, at the end, they are metabolized by your liver. And I've seen patients with these diet sodas, they end up still with steatosis or fatty liver. So I don't recommend this type of soda. Any sugar sweetened beverages or even these diet sodas. Additionally, they increase the risk of osteoporosis, so not truly recommended. We don't have much data in terms of that, but it's important to think about what are the downstream effects of these type of sodas. Okay, so those are probably one of the big talks we have to our patients in terms of avoiding these added sugars, these added calories. One big question I ask my patients is whether they ever tried putting a glass of water and 15 spoons of sugar, and I ask what you're drinking with a soda. So that's just to be more graphic and create some awareness for them. But overall, limit this, decrease alcohol intake, avoid UPFs, and limiting the added sugars overall. It's recommended for a healthy diet. And interestingly, these days also drinking 4 to 5 cups of black coffee, small cups has shown some benefits in terms of liver cancer prevention.
Good. Well, good. I can still have my coffee in the morning. That's good. That's good
There
to
you
know.
go.
Good. Another question related to soft drinks is sparkling water okay, or should it just be plain water that we should try to consume more?
Well, sparkling water depends the setting, right? If you're healthy, if you're not cirrhotic, then if you enjoy that, I'm not going to recommend against it. Now, if you have hypertension, if you have water retention, but mostly if our patients are cirrhotics, once they have cirrhosis, what we try to do is they tend to have water retention, so they have edema. This water retention is usually related to salt retention. So if you have salt, you retain water. So what we do, we use diuretics, water pills, to eliminate the salt from your system. And so if we give you a water pill and you're taking this sparkling that usually contains salt, is not ideal in patients with decompensated liver disease or even hypertension overall. Yes.
Right. Thank you so much. Dr. Brown, how is Genentech specifically addressing liver disease and liver cancer? What kind of resources do you have available?
Yeah, so thanks for the question. So, as I mentioned before, we were historically focused on hepatocellular carcinoma, or HCC, but we've now expanded our portfolio to focus on a more of a one liver approach, meaning we involve this work involves from early disease prevention efforts to advanced treatment breakthroughs. So, if I start with what we do in liver cancer, HCC specifically, I would say that our foundational commitment has been evident in work we did in the first line standard of care space for unresectable HCC. In our phase 3 study, we demonstrated that a combination of two of our compounds, Tecentriq plus Avastin, showed superior progression-free survival, overall survival, and OR response rate compared to the long-standing standard of care, sorafenib, in the first-line treatment. And that led to our first HCC approval. But over time, we were able to continue to explore different improvements in that area as well. So we had other studies in earlier stages of HCC, clinical explorations for the adjuvant and a preventive setting, and this rigorous testing of novel combination regimens that we also were able to explore in advanced disease as well. And while innovation carries its own inherent risks, not all the trials were succeeded, but we did learn a lot from the scientific rigor that we incorporated. But more recently, when it comes to liver disease, specifically MASH, we are building on our HCC foundation. So our strategic focus has shifted to addressing MASH, which, as everyone shared today, is one of the underlying diseases for this cancer epidemic. So we recognize that there's a significant unmet need for patients with compensated cirrhosis, as you said, in order to prevent liver decompensation and progression to HCC or transplantation, we have to treat patients earlier. So our research commitment has shifted to a phase 1 study and a new phase 3 acquisition, where we're really prioritizing developing therapies aimed at MASH and fibrosis. So we kind of shifted our innovative clinical research approach to the earlier phase in that setting. And to that end, we have different clinical trials that will support that, but we're being intentional in how we support those trials. When it comes to resources, enhanced patient services, ensuring that we identify areas where the patients need the most treatment and access to treatment in clinical trials, we're ensuring that we're partnering with advocacy groups and clinical trial sites that are in the community where the patients actually are. And so we're being intentional in some of those efforts, and some of our data have shown that we've been successful in being able to do that because we have been successful in increasing our representation in studies and clinical trials for the Black, African American, and Hispanic patient populations.
Great. Thank you so much. And so a question to follow up on clinical trials, both for Dr. Tsai and Dr. Ochoa. Do you have any open clinical trials currently here in San Antonio that if someone who's listening today might be struggling with liver cancer or a new diagnosis of MASH?
Yeah, absolutely. We are very fortunate to have many ongoing clinical trials at the Texas Liver Institute that focus on what we're discussing on muscle D, fatty liver. There are many trials tackling GLP-1 agonists. So we have these incretin receptors, that's the GLP, GIP, and glucagon. We all know that the GLP-1s, all of these therapies are approved for diabetes and obesity, but the they're our main focus to tackle liver disease in particular. So lots of research going on from that perspective. There's also research for cholestatic conditions, autoimmune conditions, also liver disease, liver hepatitis as well. In terms of liver cancer, I believe the Mays Cancer Center can offer that. We concentrate primarily on general hepatology, but not liver cancer. And we are glad to say that we have a tremendous team of coordinators that can really guide you through this process, can screen you, and maybe match you to the right clinical trial according to your condition.
Great. Dr. Sai?
Yeah, I won't belabor any points that Dr. Rodas already mentioned, which is bottom line. Yes, we do have a lot of clinical trials, different phases, targeting different aspects of liver disease, including liver cancer. And I saw in the chat comments, there was a comment about elastography availability. So not a clinical trial, but with Texas Liver Institute, we do have elastography events for which patients can get screened. So something to consider alongside the clinical trials.
Great. No, well, that's good to know. Going now to Jennifer. What would you say to family members to convince them that their liver health is important and to keep their lives as healthy as possible?
So first of all, your liver is such a beautiful organ. It's an amazing organ, but you cannot live without it. And the tricky thing with the liver is that so many diseases don't have symptoms until later on, until there's significant damage. And just a couple weeks ago, I was at a liver cancer event in Dallas and heard stories from multiple liver cancer families that all reported that there were no symptoms until later in the stages. So what we understand is if you ignore your liver health, it can cause devastation, but if you stay on top of it and get in front of it, oftentimes you can reverse a lot of those issues.
Thank you. Well, and going back to some of the questions that we had on clinical trials, we have such a large uninsured population here in Texas. Is there any way that they can get some of perhaps the services or testing needed to find out if they're at risk for liver disease? And I'd ask our clinicians to answer, anybody who'd like to contribute.
Yes, absolutely. We actually have programs and screening events for patients with advanced liver disease. We try to capture by partner with the community providers where we offer free FibroScan, and we have these events, and then we can capture these patients. Often they don't have any funding or insurance. In order to participate into a clinical trial, there is no need for insurance. In fact, the clinical trial may reimburse the patient in some ways for if they qualify for a research. So that's free of charge, and it's just completely voluntary. So if the patient is willing to participate, it's free of coercion. They need to understand that they can get enrolled into a placebo. Placebo means they might not get the drug, but later they might get it. We call it placebo response. But if they're willing to participate, understanding that's research, then they are welcome. And we are also doing obesity trials these days because many patients don't have access to GLP-1s. They are expensive, so they can participate if they're interested in it.
Right.
Yes.
In fact, that was another question. We know that some of these GLP-1s are expensive. You don't have insurance. I think the minimum cost somebody placed in the chat was at Costco for $500. Where can some of our patients go to see if they're eligible to receive this treatment?
Yeah, and we have more and more many industry partners are working on getting their own GLP-1s, so that's something available. And if they're interested in participating, they can reach out and we can get them enrolled if they qualify. Yes, absolutely.
And
I'll just add also that we do have as part of our enhanced patient support services, we have been able to help uninsured patients participate in clinical trials as well. So, so from a pharma standpoint, we have been able to provide that support for our trials as well.
Wonderful. Good. Well, that's good to know. We have another question from our audience from Sandy. She wants to know, what liver blood test do the doctors need to order to check if you have any concerns with your liver?
I can
Right.
jump in. So I would say the routine labs that PCPs order typically will include the liver numbers, which is basically called the comprehensive metabolic panel that looks at the kidney numbers, it looks at the liver numbers, but also part of routine screening is going to be evaluating the cholesterol numbers and the diabetes number, the hemoglobin A1C. So again, this is part of a routine health wellness visit. And if there are any indicators that the cholesterol numbers or the blood sugar numbers are abnormal, those would be the patients that we usually strongly encourage kind of further evaluation, reassessment for liver health.
Okay, thank you. Another question from Anna in the audience. She says, I have autoimmune liver disease and fatty liver. I have eliminated alcohol and soda. What should be my next baby step?
Well, so she has two conditions, not only muscle D, but autoimmune, maybe hepatitis. I don't know, but usually the same recommendations, right? We're going to recommend lifestyle changes, diet, exercise. We discuss about the Mediterranean diet, limiting the sweets. But exercise is important, right? Because you cannot really outbeat the fork. It's just relevant to do some sort of a physical activity. Just walking sometimes 20, 30 minutes, 3 to 5 times a week. Maybe I would recommend maybe 2 times, then you can maybe increase your rate of exercise. What I recommend to my patients is usually if they have a pet or a dog, then have the dog walk. Usually that's the main driver. In my family, that's what happened. I have my dog. That's how I actually exercise or walk thanks to my dog. But maybe this tiny uh, step might be relevant at the end because exercise is key, not just for metabolic dysfunction, but for cardiovascular risk. And that's key because we keep talking about the cancer risk, about the cirrhosis, but we need to understand that the number one killer in patients with muscle D, fatty liver, is cardiovascular disease. So that's important to prevent. And that's why the exercise, the diet, it's key in this setting.
And that's kind of how important how our body is all linked together, right? So it's just doing these things that are the right things, which I've been trying to promote for years, but they're the hardest things, but they are. And we all take small steps to walking more, drinking more water, eating more fresh fruits and vegetables, trying to stay away from the processed foods. It's just so important for all of us. Well, we're getting close to our time of closing, so I'd like to go ask one question and ask each of you to give me your thoughts, and maybe each of you can take 30 seconds. So the first question is, what is the one step you wish every individual would take in terms of achieving a healthier liver? So Jennifer, we'll start with you.
Just one step. I would say, no, that's hard because there's a lot of things coming to mind. I would say, know your liver, know the status of your liver health. Talk to your doctor and know your numbers, understand what your liver is how healthy your liver is.
Great. Dr. Brown?
Very similar. I would say that just proactively connect the dots between your metabolic risk and your liver health. So if you understand the risk factors, then you better have a better understanding of how to better or reduce your risk. And so ensure you're talking to your healthcare provider about what that truly is.
Dr. Sai?
Yeah, kind of the same point, which is know your liver health. But then at the end of the day, just overall good health is get moving, be active.
Great. Dr. Rocha?
And I will say that my single recommendation will be the adherence. That's very challenging. Adherence to diet and lifestyle changes. We all understand that there are many psychosocial barriers, right? Financial constraints, but adherence is key because without it, we cannot succeed. This is usually a environmental and maybe behavioral condition. So adherence to a healthy diet. Sometimes we don't have to be very aggressive in terms of drastic changes, but just following a healthy diet. Not a diet per se, but just eating healthy, good selection of food.
try to pass those sugar bars as you're checking out on the grocery counter and those kinds of things, and pick up an apple or a fresh piece of fruit. Okay, one other question. Some of you mentioned the importance of educating kind of the next generation of scientists and clinicians and surgeons, and just public health in general. What advice would you have for us? So, Dr. Brown, I'll start with you and then rotate around.
Yeah, that's a critical question because, educating the next generation is truly vital. And because we're facing escalating public health crisis that really demands, as everyone says, specialized, multidisciplinary, and culturally competent responses. And so it's so important because the landscape is changing and liver cancer health, the risk is shifting. And so for us, it's important to let them know that, they are social determinants of health that compound these disparities that we need to consider, and how do we address them. It's important to know what your community and how they're being affected by it. And everything everyone said today, truly understanding, what resources are available for you to really be able to understand and move the needle towards having better health. So it's a very important question, and education is the only way that we can reduce the risk factors that we have in the future for these patients.
Thank you so much. Dr. Rocha Ochoa?
For education, well, yes, as we have two programs, right, to treat fellows. We have a general hepatology fellowship and also a transplant hepatology fellowship. So we're trying to teach these providers to recognize this disease, and also concentrated with outreach events, education programs, community partnerships, right, to raise awareness and reduce the disparities in liver health in South Texas. Ultimately, our goal is not just to treat, but to prevent disease and prevent the burden of liver cancer overall.
Great, thank you. Dr. Desai?
Yeah, I think the key is going to be early education for identification, and then ultimately prevention. We don't need to wait until the late stages to start treatment. Treatment should be early stages to ensure reversibility.
Thank you. Jennifer?
Well, I will go back to educating the public, and I actually have a lot of faith in this next generation of adults coming into our world. I did an education event with an event with a high school group, and I was supposed to talk about generational differences in the workforce, and they were so interested in talking about liver health and understanding their livers and what the functions were. And that was really inspiring to me to see these high school seniors wanting to learn. So it's such an early stage.
Great, good. I think we covered all our populations here, so that's wonderful to hear. Okay, well, first of all, I just want to thank each and every one of you for making time today. We've gotten some great feedback from our audience, how much they've enjoyed this session. It is being recorded, and so we'll be able to make it accessible to others who were not able to join us today. So thank you again so much. I also wanted to share some important resources, and I believe we might have a slide. Here at UT Health San Antonio's Mays Cancer Center offers leading health cancer care and clinical trials. And so this is some, you can find out more about it here on our webpage. And then the Texas Liver Institute also offers educational videos, patient resources, research gatherings, and more. So please visit their website as well. And visit our Salud America website to see examples of how you can address some of these non-medical drivers of health that we've just talked about that really impact our community's health. We are so adamant to help people better understand that. We also have something that's called the Texas Report Card that shares with you, but you put in your zip code or your area that you live in, and it gives you a profile of how your community is doing with regards to some of these non-medical drivers of health. And actually, starting tomorrow, San Antonio has the Liver Cancer Symposium that's going to be held here at the Westin San Antonio North. So we hope that some of you all can join us. So, again, we're just so glad to learn about what is liver disease, how it's changing, how it's impacting our younger population, how the environment has had an impact on this as well. But what there are things that we can do, and there are areas that are preventable. So that's the positive side to all of this. So we will be adding the webinar video to our YouTube, and we'll be sharing a link to everybody soon so that you can share it with others who were unable to be with us today. And again, a very special thank you to our sponsor, to Genentech, for enabling us to conduct this webinar. So please check that site out as well. So thank you all for all that you do, the amazing work by this team to make a difference in our community. So thank you all so very much. And until next time, take care.